All right. So, hello. My name is Casey Whitmarsh, and I am so happy to have everybody back with us for our January webinar session presented by the South Fairfax Chamber of Commerce. And today we have a very special guest and a great presentation that is actually something that is near and dear to everyone's hearts, not just the businesses, but the community members alike. um, it's all about Anova and the South Fairfax community. So it should be a great session. We've got an amazing person here to kind of present everything, and that is going to be Roberta Tinch from the Anova Mount Vernon Hospital area. And we're excited to have you here, Roberta. Roberta, come on here and introduce yourself. I'd love to hear some more about you and in terms of some accolades that you have.
Thank you, Casey, and it's good to see you again. And for some of those who have heard me speak with the Federation, glad to see you again. But if you haven't met you as of yet, would love to take a few minutes and just introduce myself.
Please.
So I serve as the president of Anova Mount Vernon Hospital, and I've been in this role for about a year and a half. Love it, glad to be in the area. Prior to coming into this role, I was also working with HCA, Hospital Corporation of America, for about 12 years, and about 4 of their hospitals in Denver, Florida, Richmond, Fredericksburg. So I've been all over the place, and just love what I do and love the opportunity to bring my talents and my experience to Anova and ultimately the Mount Vernon, Fairfax, Alexandria area. In addition to my role as the hospital president, I also have another role, which is the system administrator for our musculoskeletal service line. And since that is a mouthful, I just summarize and say orthopedics, knee replacements, hip replacements, ankles, wrists, back, all of that. And that particular role within Anova is focused on ensuring that there is quality of care across the enterprise, the hospitals, the clinics, the surgery centers, case management, nursing, physicians, that we have consistent quality across the entire enterprise and not just focusing on one particular hospital. So I have this role as an MSK leader. I partner with a physician as a nurse to round that out. In addition to that, there are 10 other such service lines just like myself. So with its cardiology care, neurology care, pediatrics and children, general medicine, which would include emergency departments, surgery. So all of those sort of things. If you find yourself encountering one of our services, there will be someone who's leading it across the enterprise and really focus on making sure that you have the best experience, whether you're in the clinic or in the hospital. And so that's what's really exciting about the role that I serve now.
Well, we are certainly thrilled to have you here today and excited to learn more about what Nova does for the community and how they're just part of it. I mean, it's an integral part of it. Everybody always says the old adage, well, at least you have your health. Well, kind of starts with Nova, right? But before we get to the show, I would love to kind of do a special shout out. So quite candidly, we can't really do these webinars on a regular basis without the proud premier level supporters of our South Fairfax Chamber of Commerce. So we have Offit Kerman. I'm myself is a huge supporter of the South Fairfax Chamber of Commerce. And then we have our sustaining members that really are the lifeline of the chamber to make sure that we're continuing to help bring these great messages to the community alike. So at this point, I'd love to kind of let you take the show, Roberta, and share with us your words of wisdom.
Well, words of wisdom, you're asking for a lot, but I'll share with you what I know.
I have the utmost confidence in you. Okay.
and what I'll do is I want to touch on what Mount Vernon does, so we can talk about the hospital services that are relative to this part of the community, the South Fairfax County community. talk a little bit about our COVID response, and then spend some time at the end going a little more high level and sharing with you some of the things that Anova is doing in what we call this Eastern region from South Fairfax, Lorton, all the way up to Old Town Alexandra. So what you'll see noted here is a little bit of our mission, providing world-class healthcare every time, every touch. And as an entire system, we have that mission and we think about it in the context of providing it to every person in the community we have the privilege to serve. I often tell my team members and my colleagues, like, what we do here is very special. You have the opportunity to be on the front end of somebody's life. You have the opportunity to help them in healing. And if we find that they are not going to be going home, you have the opportunity to sit with them with compassion and help them transition in peace and dignity. That's a privilege. And it's a privilege to be able to lead an organization in those such tenets. And we do it with the values of putting our patients first. They're always first. We think about our people. We operate as a team. We do it cohesively, collectively. We operate out of a space of integrity, and we always strive for excellence. The system itself, as you know, has one medical center, Fairfax, and the 4 community hospitals. While we have 18,000 team members, we serve around 2 million individuals annually. And what that helps us do is create an integrated network of care. But what we're most proud of, which you'll see in the middle, is the recent rankings and recognition that we receive from the Centers for Medicare and Medicaid Services, which is a federal organization. And they ranked us 5 stars, 5 out of 5 stars, not 5 out of 10, 5 out of 5. And that's a huge opportunity. It's a huge accomplishment. And our 18,000 team members across the enterprise made that possible by the care they provide to each and everyone who enters our organization. We also got grade A. So we have the highest grade of safety scores, whether it's the computer systems we use for safety, the infrastructure we have in place, the physicians we have in place. We're focused on safety, and it wasn't oh, we got it this time. We have been ranked grade A for many, many years. And so it's a consistent focus on excellence and quality. And Fairfax is the #1 hospital ranked in the DC area, Washington, DC area. So we're part of an amazing system that not only has #1 ranked care, but also has emergency care, urgent care, primary care, to make sure that we have all parts of the organization covered and the community covered. Our community benefit in 2018, we're still getting these numbers updated that change all the time, but over $300 million in community benefit, which includes our charity care, unreimbursed care, research, and education. We have multiple safety net programs to ensure that we are covering all aspects of our community. And we also have an ongoing partnership with the local Department of Health to make sure that if there are needs that they assess every year, that we find how we meet those community health needs and find ways to partner. So it's an ongoing conversation to say, do our services offered meet the needs that are determined in the community? So Mount Vernon Hospital, who are we? Bear with me as I brag a little bit because I'm super excited about being here. And if I wasn't, you would hear it in my voice. But I love the team. I love what we do. I love the opportunity that we have to serve this part of the community. And we range up to the 95 corridor up north, all the way down to the Healthplex at Lorton. And we'll talk a little bit more about the services that are offered at each campus. We have centers of excellence. What this means for us is that we're constantly pursuing how are we the best? How do we communicate the best? How do we get the best medication protocols? How do we have the best relationships between staff and physicians? Because as those things work well, and as they're focused on our patients, the care just continues to get higher and higher and better and better. And that's what these centers of excellence mean. That's what these awards and recognitions mean. We don't do it simply to have a really cool PowerPoint slide. We do it to remind ourselves and our staff that we're pursuing to operate at the highest level at the top of our licenses and to bring the best care that we can for our community. These are highlights of our key services that we do: general medicine, But things that you may not know, we have inpatient and outpatient behavioral health services. We have an inpatient unit that's about 30 beds and actually have identified a need to keep growing. We have general surgery, orthopedic surgery, spine, breast surgery. We have an outpatient wound care service. So if you have a wound that's not healing or from surgery, they do fantastic work to help improve the skin quality for our patients. Our emergency department here was made largely possible by Jeff Beach, generous donation, as well as his advocacy. I remember asking Jeff, why would you invest your own money into a hospital? Like, you worked hard for that, right? We all work hard for our time and our talents and our money. And so he said, I didn't do it for the hospital. I did it for the Mount Vernon community. I did it for the families, the sons, the daughters, the friends of my kids who need emergency services. And knowing that I was able to invest in improving the experience, the flow for them, that meant a lot to me. And with that advocacy, we were able to create this new emergency department a few years ago with all private treatment rooms. We are friendly for pediatric children. If the kids have issues at school, they hurt themselves in the soccer field, we can take care of them and make sure they're stabilized and send them home. We are also a primary stroke center. And so we are a resource for ambulances in the area should a patient find that they are experiencing signs and symptoms of a stroke. And our healthplex down at Lorton has emergency services as well. It's the only ambulance access ED in Lorton. We also offer emergency stroke treatment there. So that's the idea of a system, that we do the same things for consistency. And as we need higher level of care, we have access to those higher acute, higher emergency cases and physicians at the Fairfax campus. So that's what we are super excited about. And then we also offer outpatient labs, mammography, or imaging should you need to get in and out and back on the road quickly. This is in reference to the behavioral health services that I mentioned earlier. We have an outpatient unit just down Route 1 where patients can be seen for ongoing care after they've been discharged. And we've also been giving telehealth and telemedicine options for these patients because of the pandemic. So we've learned to pivot and adjust the way we deliver care. Dr. Shershon, you see his big smile and our patient's big smile. That patient here was part of a program we called Operation Walk, where patients who have need but not the means to pay, we do several of those surgeries a year where we're able to provide both the physician costs and the hospital costs at no charge to the patient. And so we're excited to be able to offer those services. And I think she got a hip replacement. And you'll see our unit there. It is a 20-bed private unit for those patients. And we just recently were re-accredited by the Joint Commission as an outstanding unit for joint care. And just for reference, the Joint Commission is an external accrediting body that basically we have to follow all the rules to make sure that we keep our doors open, that we are providing safe care, that our building is fire safe, we have good infrastructure to facilitate safe care within the organization. It just happens to be called the Joint Commission, but we are reaccredited every 3 years. And I don't know about some of you in your industries, but we don't know when they're coming. So we just know they're coming on a window, and we get an email, actually just posted on the website, the Joint Commission will be at your place at 7:30. And we get the notification at 7 o'clock. And we know generally that they're coming, and so we're ready, but it's one of those stay ready, always safe, always doing the right thing. So when those agencies show up, you're not caught off guard because you know you're doing the right thing. The team here that's represents our inpatient and outpatient rehabilitation center. We have amazing neurosciences program if you're suffering from a stroke, learning to regain your walking. And we also have a fantastic inpatient unit that will help you rehabilitate from the following concerns. So if you were in the hospital for, let's say 6 days, and you needed additional care to work on your speech, lifting things, grabbing things, opening your dryer and your washing machine, the things that you do every day. These therapists are trained to be able to get our patients back to that daily life so they feel like themselves again. And prior to the pandemic, we actually would take patients to like Lowe's and the grocery store to help them work on grocery shopping, because not only are we taking care of you in the hospital, we're helping you take care of yourself after the hospital. We talked briefly about our wound healing center and how we have 4 locations, and we just are the largest wound care system in the metro area. And here is a picture that represents our nursing team. And on the top right here in the white coat is the CEO of our system, Dr. Stephen Jones. He's often here at the facility checking in with the staff. And we are on our journey to excellence. The designation for that is magnet designation, but it's a comprehensive shared governance between therapists, lab technicians, nurses, physicians. And so we all have to demonstrate that. And the young lady holding the newspaper, we had 11 nurses named in the Washington Post as star nurses, which is amazing. I'm going to brag a little bit. We had the most out of the system, but we love our culture. We love being friendly, and we want you to feel like family when you come here. So that's a little bit about the organization, and I'll talk to you about our COVID-19 response over the last year, I guess it's been now. This is just a picture of one of our patients that discharged last year, and just the celebration. This was early on when we were just, trying to figure it all out, but we still celebrate this day because it is an amazing accomplishment when our teams come together to help these patients go home. Back in January of last year, Anova actually started thinking about their response to this entire pandemic and established a coordination center. This was, as you can see, all the teams represented here that got together. They're still in this same coordination center. We call it our command center, IC3 Command Center. And they help us plan, what are the right processes? What should we do differently? What medication should we offer? What should we not offer? What resources do we need? How do we deploy resources? All of that to help us execute this at the top of our game. And our supply chain group, oh my goodness, they were fantastic. We have never found ourselves in a space where we've been concerned about having enough PPE and protective gear for our staff. And that is really something we're very proud of. And even when we saw the numbers in the community go down, we continued to prepare. We never let up. We continued to stockpile the appropriate equipment. And because as we saw, we got to the winter and we had the surge again, and we were prepared. And when we're prepared, our staff feel comfortable and they know that their organization will keep them safe. And we have found that our team members are staying safe while at work. As an organization, we've had over 6,000 patients hospitalized, and we've cared for about a quarter of all the hospitalized patients in the state of Virginia, which is a lot of patients. And right now we have about 242 patients currently hospitalized. If you, let me give you a point of reference. Back in the spring, we had about 430 patients that'd be hospitalized at our peak. And so that's, how serious it got. But we found ourselves in the winter not having quite as many, but we've done so many things to offer testing sites, to get PPE, and very much encouraging our staff to stay safe while they're not in the organization. And we've stopped doing things in the organization that will cause gatherings. So here we are rolling out our vaccine. We have opened up a vaccine clinic primarily for our team members and healthcare workers, and it has gone so smoothly. More than 70,000 vaccines have been given since we opened about a month ago, about 5 weeks ago. And it's something I'm extremely proud of Inova's commitment to our team members, to anyone that works in the hospital. If you are an EVS staff worker, a hospital food delivery worker, or you're a contractor, they were all eligible because they are all in the care environment and they're all heroes. And so we are very proud to be able to do that. Where we find ourselves today is as the vaccine supply is not as strong as it was to start. And so we are finding ourselves at a statewide shortage. You all have maybe seen some of this information on the news, but we are continuing to maintain the focus on our team members and slowing down and just kind of taking a measured approach to starting first doses while we maintain and ensure that we have enough supply for the second dose. So we don't want to start someone and not be able to finish. But we are following the local health district's guidance. And so many have said, well, when will I be eligible? When can my family be eligible? What can I do? And we are going to align strictly to whatever VDH has in the local health planning districts and also with the CDC guidelines. But it truly is our top priority. And as we get more doses available, we will continue to make more vaccine sites available to the general community. But we all can do our part. We can continue to wear masks. We can wash our hands, maintain our distance. Even, at home, I know sometimes it feels comfortable at home, like, oh yeah, I'll have my neighbors over. And we definitely want to be social and for our mental health, but just do it in a way that's safe or maintaining wearing a mask whilst in your home. And we will continue to follow the Department of Labor and Industries guidance for all of our employers and for our team members to make sure we are safe in the workplace. So I will pause there, Casey, and then stop sharing and open myself for questions if there are any. Thank you.
Absolutely. No, and I certainly appreciate that. I will tell you, the concept of the Veach donation, that really is tried and true for the Lorton area. I know I'm part of a lot of stuff, and I know a lot of other community members are part of a lot of stuff. And there's this mantra that kind of goes throughout the community where it's just neighbors helping neighbors. And I mean, you see that hashtag everywhere, and it was a great gesture on that, and the reason why they did it was just so admirable. So I definitely got inspired by that statement. Not that I can donate
so did
a whole.
So when he said it, I was like blown away. I'm like, wow, it really resonates that our community loves the hospital. They want to be a part of the hospital. They want to commit, and then they also expect us to be integrated. And so we have to find ways to continue to communicate with individuals just as yourself and figure out how we help everyone understand what's happening here and what they need, so that care, you talk about as long as you have your health, right? And we want that health care to be timely and accessible, right? So we want to make sure that we're doing things in the area at the hospital that make sense, but that are also accessible for the individuals who live here, because traffic is not our friend. So we just want
Right.
to manage that well.
Well, what I am most impressed about is not only the dedication and the commitment that Inova has to the community, but really what's the most impressive thing is their adaptability. I mean, to really go from something, because I'm confident, I know every business does. You have your systems, you have your processes in place, and everything was pretty much set up. And then COVID hit. And it just threw a curveball and a wrench through every single plan that was probably out there, between training and developing to just caring for people on a holistic level. So the fact that you guys were able to adapt to that was extremely impressive. And especially at the level that you guys were able to do it. That's just awe-inspiring, quite honestly.
It's something that we're proud of. And we actually are intentionally talking about that as leaders. And I'm maybe going a little deeper than you expected, but our new CEO has been here just about 3 years. And I know many of our community members have lived here 10, 15, 20 years. And I know that we are not the Anova of the past. We are the Anova of the future. Under Stephen Jones's leadership, he is talking about making sure we operate as one, making sure that we are adaptive, because there are a lot of technical things to our roles, but we're working with the health of people. And with that, we have to be adaptive to what those people as individuals need when they enter at their point of need. understanding, hey, Casey, you came in for X, an issue, but your thing is you really want to get to a wedding this weekend and you want to make sure that you're in good health to attend that wedding. That's being adaptive to make sure we address what's important to you to get you to the event that's important to you. And as we think about where Anova is adapting for the future, I talked about earlier what we call our Eastern region. And the strategy that we have there is to make sure we have access points for our community members. So we'll be doing a facility in the Oakville area near Potomac Yards and having imaging, emergency services there. We have acquired land over in the Springfield area because we're finding patients they have to keep traveling to Fairfax, and that's not an easy commute. And so we're creating a hospital site of care there, and we're continuing to invest in the services here at Mount Vernon because the population is simply growing. And we need to make sure that we are poised to receive those patients in our community at their point of need going into the future.
Absolutely. Well, I do have a couple of quick questions for you. I know, well, actually, we have one in our chat, which is, does Inova accept military insurance or Tricare?
Yes, we do.
Okay. Then that's definitely good, especially because we're so close to Fort Belvoir and whatnot. So then actually, this has been a big question. In fact, I've had people reach out to me. But how does somebody know if they're eligible for the vaccine and what priority level? I mean, what's a good resource? Because I'm sure you guys are getting that phone call all the time of, when can I get my vaccine done?
We are, and we would ask you to go and check the Department of Health's local websites for your local county and look for those resources, because that's the same guideline we're going to follow as well as we open those slots back up.
Okay. And you mentioned earlier about the supply chains as far as the PPE goes, but what about the vaccine? Is it, I mean, how is that unlocking in terms of maybe becoming more readily available in the springtime, or
we
is
are
this
at the
kind of...
mercy of the distributors at this point. We will every week we request our allocation of doses, and then we are just told what we're going to get. So I think we're in conjunction working with our federal government and our states around getting more vaccines available. So, but trust me, our CEO is sitting at the table. I'm sure, speaking up for the organization, because he knows that our system and our distribution and our process works. And if it works well, he wants to be able to make sure that we serve for our community. So he's going to try to get as many as possible, as quickly as possible.
Wonderful. And one of the things I'd love, I actually saw you and you were sharing is the last slide. It had about blood drives. I think one of the things I mentioned earlier was the whole neighbors helping neighbors. A great question is, what can the community do to help support Inova in terms of those regards? Because it's kind of like what Mr. Beach had said. We are a community, so doing things to help benefit others is that's golden rule. So
I would say blood is immensely important. We saw a very sharp drop in the spring because individuals weren't coming in, but now we know how to administer and do that very safely. And so there's a critical shortage right now. And so that would be a request. And one of my colleagues, she joked, said, if you get give blood, you also get a COVID antibody test. So you get a 2-for-1 deal, right? You give and you get. So we can see if you have antibodies, but also just encouraging everyone to go to Anova.com to look for the blood. I think it's AnovaBlood.org. Melissa can put it in the chat to find out sites and dates and times for blood drives. And we have mobile vans. I would say also, to help the hospital, thinking about neighbors helping neighbors, I would say, if you are an individual who likes to volunteer, we welcome you to volunteer. But if you have, things you'd like to offer, we have quality committees, we have auxiliaries, we have patient family advisory committees, because we don't get better without feedback, constructive criticism, and solution-oriented discussion. And that's how we know what's needed.
Okay. No, I love that concept. And I guess if that's the case, how would somebody get started on that? Is there like a specific section to volunteer on Anova's website?
The volunteering is on Anova's website. If you're interested in serving in a committee, we can, email Melissa and she'll get it to the right person because we have different committees that we work on. But we have a rehab committee, we have a general patient family advisory committee, and so she would help direct that to the right place as well as our volunteer website.
Wonderful. And it looks like Melissa put her email address in there. So we'll go ahead and share that information as well. Now you mentioned about the Springfield facility.
Yes.
What kind of, two-part question, I'm
Yeah.
sure that's on the back of everybody's in the Lorton minds. First is, when will that be done? And then second, is it going to pull away from any type of investment towards the development of the Lorton facility?
That plan would probably be done, that campus will probably be done in like 7 years. Since we just acquired the land, we were just in the design phase. And of course, the whole process of getting the approvals and sign-offs, which we have just been just well received by our local government officials. So that will be 6 to 7 years. In terms of resources, this is an investment that the organization is making there, but they are also continually making investments everywhere. I know you asked specifically about Lorton, and so what we continue to do is figure out what are the right services at the right locations. So I think it might have been another meeting we were on. Casey, around
The
what else?
Federation meeting.
Yeah, the Federation.
Yeah.
What else are we going to do with that? And we're going to continue with our imaging services. We have an ambulatory surgery center there that is available for us to put surgical cases, outpatient surgical cases there. Right now, we are finding that the population need um, that keeps going is building on the Springfield campus where we already have a healthplex and assets. And so it won't take away. And it's a constant iterative conversation of, okay, what's happening next? What do we need now? What is our community saying? What are our physicians saying? So it's never a line in the sand because the strategy has changed as we learn more. And then I heard this morning, we're continuing to look at the strategy in our central region, which is where Fairfax is. So we're always growing, we're always developing.
Wonderful. Well, that's exciting news. Um, do we have any other questions inside here? If you are shy of typing, you are welcome to come off of mute and ask. I am confident Roberta is excited to answer any questions. Does anybody have any questions that they want to share with Roberta or ask Roberta?
I'm good. Very good presentation.
Thank you, Ms. Denise.
Wonderful. All right. Well, is there any last minute things that you'd like to share? Your presentation was amazing. We will be sharing this on the chamber's website. So for folks that didn't catch it, you're welcome to share it out there.
Just sometimes I think when people think of hospitals, we think of just like doctors and nurses caring for that moment in time. But when I think about the work we do here, I think about the people who do the work, and we are constantly striving to be better. And we talk about our patient's experience, the family's experience. How do we communicate with them? But just as importantly, we talk about our team members' experience. Do they feel like they're working in an environment where they have safety and trust, and their feedback is put into action? We're always doing that, and I'm really excited to say that we do have that sort of organization. And so, what has helped us so much is our teamwork. And it might sound a little pageantry, but it's the lifeblood of this organization. It's what makes healthcare compassionate, and it's the people. And if you ever see me and the team, we laugh a lot. We have a really good time, and we work hard, but we're friends. And I think that's what makes this work special.
I love that. It looks like we did have one more question that popped up, that there were surgery EVS service or EVS services at Lorton. I I pardon
The
my
surgery
ignorance.
serv-
I
yeah,
don't know
we
what
had surgery
EVS.
services. Yeah, we had the surgery services at Morton. I think, Michelle, is what you're referring to. So I think about 2 years ago, prior to my coming, we did have a fully operational surgery center there, and we had a surgery center at Springfield. I think what we were finding is that they weren't working both at full capacity, so those were combined, and they were combined at the Springfield location. In recent months, we've been talking with different physician groups, asking if they are interested in reopening that surgery center with us. It's still licensed, it's still available to be used, but it's finding the right physician partners now that the Springfield ASC is fully at capacity. So it's still an opportunity for us to develop with our physicians in the future. I
Wonderful.
hope that answers your question.
Michelle, is that a good answer to the question? Do you have any follow-up questions on that?
Okay,
There we
thumbs
go.
up.
You got the big thumbs up. That's awesome. You got to love technology, folks.
I do.
Okay. Well, once again, Roberta, Melissa, I want to thank you both for showing up today. It definitely means a lot to us to know that we have such a wonderful member of the community to help support the growth, development, and the health. I mean, really, I made the joke of it earlier as far as that at least you got your health, but really at the end of the day, especially with COVID coming out, it really brought us that focus on making sure that you do what you're supposed to be doing to kind of take care of yourself, take care of your community. It really brought around, awareness. Awareness is probably the key word on that, and
Yeah.
I think that is most relevant in this day and age right now. So thank you guys again for coming in and sharing. We definitely appreciate it. We're going to go and share some of this other information that Melissa put in the chat. And we definitely want to put pose that request out to the community that if you have the time, help. You can do your part by donating blood, and you get a free COVID test at the same time. So, so give me 1 second. Let me go ahead and we will. Just to kind of wrap things up, I do want to kind of let everybody know we do have our February webinar already scheduled. It's going to be on February 23rd. It's going to be life insurance and divorce. It's going to be presented by the South Fairfax Chamber of Commerce member, Offit Kerman. And it's going to be a great presentation on that topic. So please look out for the signups. It's going to be on all of our social media stuff, which is can be followed at the SFCC Commerce for Facebook, the SF Chamber of Commerce for Instagram, and Twitter at South Fairfax. So once again, I really can't thank you guys enough for showing up and showing off the amazing efforts of Inova. And we look forward to a continued support and a very prosperous and right trajectory for the 2021 year. All right. Thank you all for attending, and we hope you have a wonderful day and stay safe.
Thank you.
Be
You
warm.
too. Take care, guys. Stay safe.
Thank
Bye.
you, Roberta.
Thank you all.